Let's hone in on this now. Health Minister Dr. Zweli Mkhize calling for calm after coronavirus variants discovered in India and the UK were detected here in South Africa. 11 cases of the variant first found in the UK and 4 cases of that first found in India have been found here. The news comes amid signs of a third wave of infections in some parts of South Africa. Mkhize says all cases have been isolated and contact tracing is currently underway. For more on this, let's bring in the co-chair of the Ministerial Advisory Committee on COVID-19. That's Professor Koleka Mlisana, who joins us now via our video link. Prof, great to see you. Thanks very much for making time for us here on the AM report. So 11 cases of this variant first found in the UK are now in South Africa. That seems to me, at least on the face of it, that this particular variant is at a level of community transmissibility. Do we have reason to believe that there are more of this variant than what we have on record in South Africa?
Morning, Ayanda, and thank you for having me on the show, and good morning to all the viewers. Yes, we are concerned because if you're looking at the report, the B117 really has been around, and it actually, we believe that there probably is community transmission that is happening. And that is why it always really just becomes important to make sure that whenever we identify a positive case, whether it be B117 or B351, contact tracing and testing to clamp down on those, infections and transmission as quickly as possible. But really, I think there's enough, evidence to believe that it's already in circulation. What does that mean about what we possibly need to do from here on? We already have different scientists weighing in about the possibilities. Take me through what you're thinking about. Okay, so really, I think the whole issue of variants that are emerging, what we need to be clear about is that for as long as the virus continues to replicate, it will mutate. What we just don't know is what sort of animal it is going to mutate to. Is it going to mutate to a variant of concern or not? But otherwise, we cannot control that. But what we can control is ensuring that, the transmission is actually prevented or reduced as much as we can. So the fact that now we have got both the B1351, which was discovered here first, as well as the one that was from the UK, and we now have shown that even the one that was first discovered in India is in the country. It therefore becomes important to ensure that individuals actually adhere to non-pharmaceutical interventions, because remember, these variants, even though they are of great concern, they still cause the majority of infections that are asymptomatic. So that's why we will miss picking up transmission, at times, unless people get to a stage where they are sick and present to hospital or need to be tested for whatever reason. So that's why it becomes important for us to really reduce transmissions at community level. Yeah, that term, Prof, variant of concern, suggests to me that there are variants that are not of concern. Give us an idea of how you make the distinction between the two. Okay, yes. So we actually have come up now with this term. So it's either, first it becomes a variant of interest. Once we see a variant that's emerging and it seems to have mutations, especially if it has mutations at critical points in the genome of the virus, then they become variants of concern. And we need to look closer to them and see their characteristics. And what are some of the things that we look for? We look at what about transmissibility? Does it actually increase transmission to people who are susceptible? Does it then have an impact on the severity of the disease? That's the second thing. The other thing that we look at as well is to look at then what about those that were infected by the previous virus? Their immunity, does it protect them against the emerging variant? So we look at susceptibility and immunity. which means is the previous immunity protecting the individual from the variant. And the other thing we look at is what about vaccine efficacy? Is the variant that is emerging, is it covered and efficiently so by the currently existing vaccines? Those are some of what we look at. And if any of those appear to actually, we're seeing increased transmissibility, or we think there might be severe disease, then it becomes a variant of concern. So at the moment, globally, we have the B117, which was originally identified in UK. We have the one that was first discovered in Brazil, the P1. We have the one that was first identified here in South Africa, B1351. And recently, I think it was the Public Health, England Public Health, just classified the B1617.2, which was first identified in India, as the variants of concern. So those are the variants that everybody is worried about at global level.
Yeah, let's hone in on the science a bit more if we can. We've heard a lot that part of what makes these variants problematic is something called the spike protein, which makes it difficult for the current candidates of vaccines at our disposal to provide sustained immunization. In other words, these variants are able to bypass the vaccines. What do we know about the 3 that are currently now on our shores and their ability to bypass the candidates that we're currently procuring in South Africa?
Okay. Obviously, because the B117 and the B1351 have been with us for a reasonably, for longer periods of time. So there's data that is accumulating on those. If we're looking at the one that was first discovered in the UK, B117, we have seen that the mutations that are there actually allow the virus to be more transmissible. And also, when we're looking then at the one that looks at evasion of immunity, the data shows that there is a level of reduced efficacy, but very minimal. So even with vaccines, if you're looking at B117, even though there's a limited, efficacy, but it is really very, very low. We're talking 2 to 4-fold. Whereas if we're looking at the B1351, which is the one first discovered in South Africa, there's a significant reduction. And as a result, that is why, for instance, we're very clear when we saw AstraZeneca and the results of AstraZeneca. But then looking at the other vaccines that are available, for instance, the Johnson & Johnson, it still gave us a good 67%. But if you're looking at other countries, they're looking at, efficacy levels above 85%. So really that is the level of, escaping immunity that we're talking about. And now when we look at the one that has been first discovered in India, obviously we just don't have enough data to be able to make those assumptions.
Yeah.
But looking at the behavior of the others, there probably will be a reduced level of efficacy.
Right.
But I want to say this very quickly, that when we look then at vaccines that are available, we have shown that all these variants of concern actually have got high efficacy at preventing moderate to severe disease as well as death. So the end spectrum of the disease, it seems to be covered by this, the vaccines do cover this variant. What we are not sure of, and there's not enough data, is on mild asymptomatic disease, infection as well as transmission, obviously.
Yeah, that's a kind of an important silver lining that we'll hopefully keep reminding ourselves of. But there's obviously a great interest in trying to learn how the variants interact with the vaccines. But do we know how the variants interact with one another? In other words, is there a possibility that these mutations could interact and bring forward another mutation, which could obviously bring about all kinds of complications for our fight against the pandemic?
Sure. Okay. So really, if we're looking at mutations, it's more like if a virus replicates and mutates, so it's going to mutate to whatever variant that is there. What really is of more concern for me is whether if you are infected with variant A, your immune response, does it protect you from variant B, C, or whatever, variant to come? And we don't know that. We know, for instance, though, that of the currently existing variants of concern, the advantage that the B1351 originally, identified here, has got a broader immune response, in that when it was tested against sera that actually had people had been infected from the variant 117, B117. There was protection there. And in fact, I think there's preliminary data that is showing that the B1351 ex-South Africa, actually also the immunity covers the B1617.2. So we're still trying to understand that. But your question that you're raising, what we don't know is into the future, what kind of variants are likely to emerge. And we will have to really just, be there and make sure that there's close, a monitoring of these viruses as they replicate and mutate. And we have got those systems in the country. So really our scientists are working day and night and ensuring that, this genomic analysis is done and is done very close to real time as is possible.
Sure. So if I'm understanding you correctly, one person could be infected with variant A. If variant A does not provide immunity against variant B, that same person could be infected with variant B and have severe illness in both instances, possibly.
Well, remember, the immunity from variant 1 would actually have tackled the infection of variant 1. So by the time you get exposed to variant 2, you would not be infected with variant A, because you have developed immunity.
Correct.
So it's not going to happen. There's not going to be a situation where, whilst I currently have got variant of concern A, I then get, variant of concern B. But what we're saying is that you will have variant of concern A, you get the disease, it's mild because, and as a result you then develop immunity. Now we don't know whether that immunity you will develop is going to protect you to the next variant.
Sure, fascinating. What does that mean then, as the co-chair of the Ministerial Advisory Committee, about the kind of advice that you'd need to give government? Already we've seen some experts coming out mildly gesturing at something like a harder lockdown. Is that something that would be on the cards as far as you're concerned?
Okay, so, for me, the approach has got to be even beyond what government must do. The first must be our responsibility. And that's why we can't finish a talk without non-pharmaceutical interventions.
Yeah.
Because irrespective of what variant it is, wear your mask properly, sanitize, social distance. That is critical, and that's the South African community responsibility. Now, what happens? What must happen, so far as government is concerned, we need to be ready and be actually vigilant in that if we see a cluster of infections, quickly go in and intervene and get the genomic analysis team to come in and do the surveillance and monitor the situation. The other area that is important, because these variants of concern, some of them are coming from outside of the country, we've got to have strict regulations at the borders where everybody who's coming in gets tested, and there must be very clear guidelines of isolation for those that are positive and quarantine for those that are negative, because we want to make sure that people, by the time they can get into the communities, into the country, they actually have cleared their infection. So those are going to be very, very important.
Professor Koleka Mlisana, thank you very much indeed for your time. Hopefully there's much better understanding about how these variants work and what we need to do to ensure that, of course, we don't escalate the situation as it stands. Professor Mlisana is the co-chair of the MAC on vaccines, or the MAC on COVID-19. That's the Ministerial Advisory Committee. Thanks very much indeed.